Prescription drug diversion and abuse is the #1 drug control problem in America and in Florida. I'm Bill James, the director of the Florida Office of Drug Control. Today we are producing an education and awareness video about the dangers of prescription drugs. Our medical examiner report in Florida indicates that 3 times the number of Floridians die annually of prescription drug abuse than do of all illicit drugs combined. The rate of growth of prescription drug abuse, as indicated on the medical examiner report, is growing 3 times that of illicit drugs. A monitoring plan for drugs that controls the dispensing of these drugs is important, but more importantly, we must build education and awareness, and that's what our video is doing today.
It's a growing trend. People from all walks of life abusing legal prescription drugs. The drugs, when used as directed, effectively treat everything from anxiety to pain. When abused, they can have an entirely different effect.
The number of deaths attributed to prescription drug use and misuse is rising every year at a dramatic rate. In comparison to a relatively steady rate, slightly increasing though for illicit drugs. It was just a few years ago that the numbers of prescription drug deaths exceeded those from drugs like heroin and cocaine.
You've probably heard some of the brand names, Xanax, OxyContin, Vicodin, but the prescription problem involves much more than those popular drugs. The most abused types of drugs are pain relievers, stimulants, sedatives, and tranquilizers. But any prescription drug can be abused, and if combined with other drugs and substances, the results can be tragic.
I'd say most people, especially young, naive people, do not understand the dangers of these drugs. When you mix even small doses of an opioid and a benzodiazepine, you can get synergism. So rather than 1 + 1 is 2, the effect may be like 3 or 4. So it's an exaggeration of the effect. So that can result in severe toxicity, coma, and death.
Prescription drug abuse defies stereotypes as well of who a drug user is. No one is immune.
Anyone can become involved with drug abuse. Any age, any race, any country, any background. These drugs are available. They're intended for very legitimate purposes, but they're often abused, and when the abuse starts, that can lead to addiction, and then you have the problem.
Many people who would never think of taking illicit drugs often end up abusing prescription pills, thinking they're safe.
When it comes to a prescription drug, it has the pharmaceutical markings present on it. It says the dose. It's readily identifiable and recognizable by many people. So there's a sense of safety and security, and these drugs can be used and misused.
Teens often abuse prescription drugs socially, taking them from home and trying them, looking for a high.
We do have that conversation with our patients, especially in these times when you hear of students having parties where they're just sharing medications and not knowing what medications they're sharing. A lot of times they will prey upon their grandparents or parents who may have a significant illness and just take their medications inappropriately.
Some patients who legitimately see multiple doctors for different ailments might accidentally combine prescription medications that don't work well together, causing an overdose.
We need to know everything they're taking, and we do ask them for any over-the-counter medications, any herbal extracts, or any kinds of medications that other doctors are giving them because of the different kinds of interactions that may occur.
Many Americans take at least one prescription drug, so they're in our homes. It's simple for anyone to take just about anything from a medicine cabinet.
I don't think anybody really thinks to, lock up their medicine cabinets. It's an at-home drug. It's not something you really have to go out on the streets and seek, and, it's legal. They're legal. They're just basically laying around. I never really had to call more than 3 people. Somebody had access to something. And if they didn't, they knew somebody that did. When it came to getting pills, it didn't take me very long to get what I was looking for.
And many abusers get their drugs directly from their doctors, something some law enforcement officers are aware of.
The one issue that is dealt with most is what they call doctor shopping. Doctor shopping is obtaining multiple prescriptions or overlapping prescriptions from multiple providers without the providers being aware of the other. It's illegal, one, because they're lying. There's a number of states that have laws, established laws, that state providing false information in an attempt to obtain a controlled substance is a crime. A lot of the states establish that as a felony crime.
And it's often all too simple for the addict to dupe a doctor, something physicians need to know about.
It was easy to go to different doctors and not even have MRIs or anything. I went to doctors that just said, "What do you need?" and just took out a script pad and just wrote me whatever I needed. And as that became easier, it became easier to get whatever I wanted, wherever I wanted to. It didn't matter anymore because the doctors made it so accessible for me. And it wasn't just me that was doing it, it was everybody that I know.
Then there are the dealers and diverters, people who obtain medications in some fashion and sell to users at a high profit. Sometimes the addicts themselves even sell a portion of their own medications just to maintain their habit. So an important line of defense is the pharmacist. They need to know how to spot fake or altered prescriptions or people who are doctor shoppers. But it's not easy.
I'll say over the years, I think the profile has changed. You'll see patients, obviously the drug addicts, if you will, but you'll also see the typical patients, co-workers, people that are taking the medications to get the maximum effect of them, and they don't even realize that they've become addicted to some of these drugs. And they do have a far greater addictive potential than a lot of people realize.
Possession of a drug that is not prescribed to you or not monitored by a doctor is illegal, no matter what the intention. And too often, people try to self-medicate, trading drugs to treat symptoms or escape reality and achieve a high.
It's legal to have a prescription drug when you have a legitimate medical purpose. You've seen a practitioner who's acting in the usual course of their professional practice, and it's been documented in some type of chart. That's the legitimate way to obtain a prescription drug. The illegitimate way to obtain a prescription drug, or when a person is illegally in possession of it, is when they've lied to a doctor, when they've stolen this, when they've gone to an internet pharmacy without a legitimate medical necessity.
The key to all this, keeping prescription drugs in the hands of those who need them to treat legitimate medical conditions, and out of the hands of people who could abuse them. So what can you do? Secure your prescriptions. Keep an eye on how many pills you have in every bottle so you can know if some are missing, even if you're the only one in the house. Guests, workers, or even visiting family members could take pills that don't belong to them.
They don't leave them laying around in a purse or in an open medicine cabinet to keep them under lock and key, just like you would a gun. Because in the end, they're just about as deadly.
Talk to your teens. Explain prescriptions are drugs and can be as dangerous as taking illicit drugs. In fact, some prescription painkillers contain opioids, same as heroin.
Education is important to get that information out so we can tell our young people that abusing these drugs, misusing these drugs, can lead to death.
Don't take any medication a doctor did not prescribe to you. And tell your doctor about any medications you're taking, even the over-the-counter ones and herbal supplements. They too can interact badly with each other, often causing lethal results.
Even if you're seeing a psychiatrist, a pain doctor, and an internist for a whole variety of medical reasons, you should share all of your medications with all the physicians so they understand the potentials for drug interactions.
Dispose of any medications properly. Don't just throw the bottles in the trash with leftover pills inside. Remove the pills from the bottles before discarding, or mix the prescription pills with something like used coffee grounds or kitty litter and throw away. You can flush some drugs down the toilet as well, but only if the labels or patient information says it's okay to do so. Awareness about the prescription drug problem is the first step, but there's still more to do.
You certainly can fix this problem, but it's got to be multifaceted. There's no silver bullet to solve it. The prescription drug monitoring plan is a part of it. The law enforcement effort is a part of this. The education and awareness of which this video That's a part of it. Our plan must be comprehensive, focused on communities and families.